Hello, this is Gayle Palmer, the osteopath from the Living Elements Clinic in Siddlesham, where your health is my priority. I wanted to make this video because men's health is often overlooked, and there are certain things unique to men that need to be addressed and often aren't. And I think that's partly because men don't have quite such the same support system sometimes, or ability to talk about things that women perhaps are easier, more comfortable doing. So one of the biggest issues for men as they get older is prostate health, and possibly prostate cancer as well, which is a killer. It's quite a big killer in this country. So I wanted to explain a bit more about what the prostate is, what it does, how to understand some of the symptoms that it may cause, and also what you can do about it, and the sort of treatments that are available, so that you can also increase your chances of preventing problems, which at the end of the day is so much easier to do than putting up with them. So the prostate is a walnut-sized organ. It's at the base of the penis, but still within the pelvic cavity itself. It surrounds the urethra, which goes through, you can see that, which goes through the middle of the gland, and a result of which, if there's change in the gland itself, sometimes the urethra gets pinched, and that reduces or changes the flow of urine through that area. The prostate organ also produces a fluid, the prostate fluid. No prizes there, and that makes up part of the ejaculation fluid as well. It is produced throughout life. It doesn't have to just be produced during ejaculation, but excess fluid is just gets lost in the urine. So over time, it is common for this organ to increase in size, most commonly from about 50 years onwards, and this is considered normal. It may or may not be normal, but it's common. This increase in growth is called hypertrophy, and it only really becomes an issue if the increase in size starts squeezing on that urethra and changes how urine flow is able to take place. So signs and symptoms of prostate problems include difficulty or slow passage of urine. It includes difficulty starting passing water, or stopping, and that might include dribbling later, etc., which is very common. As I say, there's a really strong tendency to leak afterwards. An increased frequency in needing to go to the toilet, particularly at night, which can be quite distressing. It rarely gives you pain though. So sometimes, especially if the pelvic health is not great, for instance, that can be damage from a back injury, a disc injury, localized trauma. I've had cyclists in the past, so competitive cyclists, because of where the prostate sits in relationship to the bicycle seat, that can cause local abrasions over time. Or cancer elsewhere in the body, which will metastasize or produce secondaries in the prostate gland. The prostate gland enlarges due to malignancy versus the normal aging process at that point. So a lot of these problems can be picked up by doing a simple blood test, the prostate specific antigen test, the PSA test. It may not be 100% accurate, but it's a good indicator of possibly cancer, and does require further investigations. So your doctor will almost always do this simple test just to make sure what is happening. So the normal limits for a PSA test are between 0 and 2.5 nanograms per milliliter. It's a tiny amount. So that is considered normal. Levels above 2.5 nanograms per milliliter require further investigation. It does not necessarily mean, though, that you have cancer. There can be other reasons for having an increased PSA test, but it does need further investigation. So men, know your figures. It's really important, because then you know what to do about it. So if there's no cancer, the oversized prostate and urethral tube pressure can then be released by creating an increased borehole through that, canalizing it in effect. It's a bit uncomfortable, but it's a day surgery procedure, and within a day or two, life returns to normal. You can pass water freely, you can stop, start, all the rest of it. It's nice and quick and simple. If cancer is detected early, there is also a superb range of treatments that are available, from surgery, chemotherapy, radiotherapy, all sorts of other options that the medics can undertake. But what can you do for yourself to help your own prostate health and your general health improve? There are some very simple guidelines. Increase your intake of fruit and vegetables to at least 6 to 8 portions each and every day. The fruits and vegetables are coloured, as you know. Those produce chemicals which are anti-cancer. So they will go around mopping up cancer cells as they're produced. We produce millions of them every day. Our bodies just get on and deal with it. It's actually quite rare for a cancer to be produced that then maintains itself. I recommend for some of my patients, if they're really stuck with fruit and vegetables, that they take some supplements. I've got some fantastic ones in the clinic called carotenoid, flavonoid and cruciferous complex. They're brilliant. Second thing, take either a high quality fish oil supplement or eat large amounts of wild oily fish. That could be salmon, tuna, mackerel, pilchards, sardines, anchovies. Okay, those contain omega-3 oils, which are essential for anti-inflammatory effects. Any inflammation increases the likelihood of cancer. They also have strong anti-cancer effects, particularly on prostate, but also breast cancer, which is a risk factor for men as well as women. Number 3, take regular exercise, at least half an hour a day of fast walking if you can. Other exercise, fabulous. 4, get out and about in the fresh air. Go and enjoy life. That's what we're here to do. It helps to invigorate your mind. It gets your circulation moving. It's particularly important for moving your pelvis and pelvic organs, legs and circulation down there. That makes a big effect on your prostate gland and your pelvic function. 5, stay positive. Even if you have a cancer diagnosis, does not mean you're going to die, okay? So stay positive. If you have a negative thought, thank it for its contribution, throw it out, okay? Keep that maintenance of your mind, because your mind makes a difference to how your body works, and that makes a difference to how you are in life. 6, go to your Wellman clinics regularly when you're called in, okay? Simple, quick, easy, do it. 7, do a self-examination regularly. Doesn't have to be more than every 2 months or so. Self-examine your testicles, self-examine your penis, have a good old rummage around down there. Look for lumps and bumps that are a little bit unusual. Best time to do this is if you're sitting in the bath, you're relaxed, and it's just gentle, okay? If you're worried about anything, go to your GP, please, ASAP. So I've treated a number of patients with prostate cancer over the years, and I have to say prostate cancer is increasing over time, and that's partly because we're living longer and our diets are not so great. I have a mixed allopathic or traditional approach and an alternative approach. So in addition to traditional techniques to help your low back, pelvic and abdominal health and circulation improve, I also work on an energetic and spiritual level, and I find that's quite effective for pelvic problems. So if you're interested in finding out more, you are welcome to book into a free 10-minute complimentary consultation, or you can book online via the website. Just hit the book now button, or via the Living Elements Clinic Facebook page. So there'll be more posts about men's health coming soon, but for now, that's all from me. Your health is my priority. Place your healing in my hands. Take care. Bye-bye.